You've been hearing for months now in advance from public health officials about getting your flu shot amid the pandemic. Doctors hoping people listen up and make an appointment. Alexandra Leslie spoke with a physician at Hasbro Children's Hospital and joins us now with the top reasons why doctors say you should get your flu shot, especially this fall.
Well, the first reason is pretty simple, and it's one that we hear every flu season. If not just for your own health, doctors want you to get the flu vaccine to protect others who are around you that may be more vulnerable. Now, Dr. SILVIA CHIANG tells me that another big reason we've been hearing this can potentially lessen the strain on the healthcare system, since flu season historically puts a burden on hospitals in the wintertime. Doctors say since flu and COVID symptoms are also similar, a test will likely be done to figure out which one you have. So there is a possibility a bad flu season could mean another big demand on COVID tests, in addition to a demand for hospital beds. Third, both flu and COVID are serious diseases that can both cause you to become very sick and have the potential to become deadly.
Just having one of these viruses by itself is bad enough. Having both of them at once, we don't want to know what will happen if somebody has both at once, especially if they're older, especially if they have underlying medical conditions.
Doctors say the ideal time to get the vaccine is anytime now through mid-October, as the vaccine takes about 2 weeks to become effective. Coming up in the next half hour, Dr. Chiang debunks some of the biggest myths about the flu and the flu vaccine. Live in Pawtucket, Alexandra Leslie, 12 News.
Other news now, will the flu vaccine give you the flu, or if you've had it once, can you get it again? And these are some of the common myths out there doctors want you to know the answers to as we head into flu season amid the pandemic. Doctors say it is more important than ever to get vaccinated. Alexandra Leslie spoke with the doctor at Hasbro Children's Hospital. Alex, what are some of the most common misconceptions?
Well, the first big myth out there that you've probably heard is that the flu vaccine gives you the flu. Doctors say that is not true, but there are some reasons that you probably think that may be the case. Now, the first is that the flu shot takes about 2 weeks to become effective. So if shortly before or during the time that you're exposed to the flu vaccine probably won't protect you. But doctors say it was not the vaccine that caused you to be sick. Plus, it's not just flu season. There are plenty of other viral infections that also make the rounds this year. You might have caught one of those. Also, no one is immune to the flu.
Even if you had the flu before, the virus changes a lot. That's why the vaccine changes all the time, because the virus mutates a lot. There's many different types of flu viruses. So even if you've had the flu before, that does not make you immune to getting the flu again.
Flu, but you didn't already get the vaccine before that, you can get the vaccine after you get sick. Flu season really starts to pick up in November and sticks around until as late as April. Live in Pawtucket, Alexandra Leslie, 12 News.